Hi, this is Crystal the Herbalist, and in this video I will be talking about the therapeutic action of diaphoretics. Now this is such an important herb group that I've split this into two parts. The first one will talk about what diaphoretics do, and the second part will talk about the most common herbs used. This is such an important action in the following ways. They enter the circulation and then are thrown off by the sweat glands. They stimulate the local nerve fibers to these glands to increase the action. They influence the peripheral sensory nerves, which relax and dilate the superficial capillaries and vessels. Surface circulation is affected, and then the whole circulation, so it increases the blood flow, resulting in perspiration. The sweat glands originate in the spinal cord and medulla, so diaphoretics stimulate these glands indirectly by stimulating the cells in the central nervous system. Dr. Knowles states in the condition where the system is hot and the skin dry with a pulse that is full and frequent, a relaxing diaphoretic should be used. But if the heart impulse were weak, the skin cold, we should use a stimulating diaphoretic working from the center to maintain the heart. Oil glands work in conjunction with the pseudoferous glands. This is why the skin is soft and pliable. So when the glands are not working right, the skin becomes hard and chapped. So in the case of eczema, the oil glands and perspiration should be stimulated. Sweating or diaphoresis is the best way to restore health in many cases. When the pores are blocked, the bloodstream becomes toxic, poisoning the whole system. Because herbalists have used herbs to equalize the circulation, they become quite successful. They used vapor baths to treat fevers along with the diaphoretics. They realized that anywhere the general circulation was involved, diaphoretics were needed. Maintain an outward flow of blood, and you will have your patient on the highway to recovery. Diaphoretics should be given warm. Even hot water is a diaphoretic. If given cold, the kidneys will be involved, so the bowels need to be clean as possible. Other important factors to consider: cold drinks should not be given between doses. Never overdo diaphoresis, it can exhaust the patient. Cathartics should not be given just before or during the administration of diaphoretics. Diaphoretics induce increased perspiration by affecting the sweat glands. These herbs relax sweat glands and increase perspiration, thereby influencing the skin and nervous system because it opens the pores, letting out poison, thereby keeping the blood pure. In other words, diaphoretics are one of the most important herb groups because they clean the foul mucus conditions from the entire body. If you like the value received here today, please let me know on my Facebook fan page, Crystal the Herbalist. If you need to ask me a question, ask me on Facebook or email crystal@healthherbs.com. You can actually order herbs in bulk or liquid tincture at www.betterhealthherbs.com. Good health to you.